Hello moms and dads, I'm Corinne. Today's video is all about the different color of your baby poo. What do they mean? Is it normal? Can you just sit around and hope that it changes color? Or do you need to ring your doctor immediately? Baby stool varies and it changes all the time depending on baby's feed, whether they are breastfeeding or bottle feeding. So in this video, I will be telling you what color and consistency the stool shield should be looking like. What should you expect and when should you call the doctor? I will start off with discussing poo that is white or gray in color. So immediately we think that this is definitely not normal. If your baby just passes one gray or white color stool and you are breastfeeding, it may be something that you have eaten, so do not panic. Baby's undigested milk may be turning the stool a white cottage cheese like color, or any new medication that your baby has started. Check the side effects. Obviously, there are certain medical illnesses, medical conditions that can turn the poo pale or white looking. If your baby is constantly passing gray color or white stool, this means that the stool is lacking in pigment. Okay, so pigment really is what gives everyone's stools color. So if your baby has a cream or white bowel movement, then there might be cause for concern. My number 2 color is green poo, green stool. Green stool is sometimes known as transitioning stool. So where the baby is going from green meconium stool to normal baby poo. So this is perfectly normal. Within the first 24 to 48 hours, your baby may only have green stool, but this is completely normal. If your baby is on solids, then some of the green, nice, healthy, leafy vegetables that you are giving your baby might not have enough time to digest properly. Babies occasionally passes green stool, and we know that all babies need to pass this first poo when they first born. However, when should you be worried about green stool? Is your baby above 3 months old? Is your baby having lots of green stool? There are certain medical illnesses that need to be ruled out, especially if your baby is having watery green stool. It might be a virus or a bacterial infection. Our another color is black poop. When should you be worried and when should you call the doctor? Again, if your baby is bottle feeding and on solids, then black poop might be caused by something that your baby has eaten. And if you are breastfeeding, then black poop may be caused by something you have eaten. Again, keep an eye on your diet. Keep an eye on baby's poop. So we expect black bowel movements in the first few days of life. Your baby's first stool is called meconium and is very sticky. It can appear as being very dark green or black. But it's not normal if this comes back later. That's when our alarm bells will be ringing. Black poo may mean there may be blood in your baby's poo. Unfortunately, there might be other underlying conditions, other illnesses that may turn your baby's stool black. What about red poo, red stool? Should you be worried? And if your baby is breastfeeding and maybe you've eaten something which has red in it, like beetroot, for example, some other things in your diet like raspberries, strawberries. Also, if your baby is bottle feeding and on solids, then these food might make the poo turn red. If you have not eaten any of these foods and you are still concerned, maybe wait a few more hours and see if your baby's stool changes. Keep an eye on your diet. Okay, so we all know that baby's stool should not be red. Red stool rings alarms bells in everyone. It's something that you should really check with your doctor. Again, the red poo might be that there is blood in your baby's poo, in your baby's bowel movement, your baby having some infection. Okay, so this needs to be checked out by your doctor. Is the color of your baby poo normal? If your baby is pooing yellow, brown or orange, sometimes even orange, yes, this is quite normal. And again, this varies in consistency. Whether you are breastfeeding, you bottle feeding, the normal stool for a breastfed baby is a bit runny. Okay, it's normally a bit yellow, it looks yellow, a bit of mustardy color. For babies who are bottle fed and are already on solids, you can expect the stool to be a little bit brown, a little bit like adult stool. Of course, the stool color can tell you a lot about your baby's. Does your baby have unusually colored stool, fever, dehydration, tummy pain, vomiting, crying excessively? Then you must seek medical help. So if you find this video helpful, please like, share, give me a thumbs up, comment, and let me know. Give me some suggestions on what you need me to cover in my next topic. So thank you so much for joining me.